Looks like all of the blood tests and other testing are normal.
Thank God. What do we do now?
Mr. Ibrahim, it's most likely that your trouble is due to dementia, a disease that affects a person's ability to think and speak. But I would prefer for a specialist to see you at least once.
Is there any medication I can take for that?
Dementia. God help us.
It's normal to be anxious and worried. Dementia is an illness of the brain. The difficulties may increase over time. There is much that can be done to help Mr. Ibrahim feel more comfortable and to make life less stressful for you, Zaina. I will advise you to see a neurologist to see if any medications are required.
Oh, I'm scared that one day he'll go out and never find his way back home. I'm also worried that he'll stop recognizing us altogether.
I fully understand your worries. Ensuring Mr. Ibrahim's safety is our top priority. I think it is best to try to prevent him from getting lost, while being sure that Mr. Ibrahim feels like he can be as independent as possible. Be sure that Mr. Ibrahim does not leave the home unsupervised, but goes on walks together and stays active. I also suggest that it would be good if Mr. Ibrahim wears a bracelet or a necklace with his name, your address and phone number. This will help in case he gets lost.
Strategies to deal with wandering. For outings, review trips in advance. Avoid crowded places and try to go to the same places on a regular basis. Do not let the patient walk alone and stay close when on outings. Reduce distractions and keep the patient's attention by talking to them and making eye contact. What to do if the patient wanders? Be sure that the patient has identification information with them, in their wallet, pockets, around their neck, or embroidered on their clothing. The patient should not wear valuable jewelry or have excess money or credit cards with them. Make a plan if the patient wanders. Know who you will ask to help you find the patient. Keep a picture handy so you can use this to notify neighbors and authorities. Don't wait for the patient to come home. People with dementia get lost, even if very close to home. Promoting independence, functioning, and mobility. Encourage the person with dementia to continue daily activities, even if it takes more time, such as dressing, eating, or the toilet. Keep the floor around the house clear of clutter to avoid the person tripping and having a fall. Put up signs for key locations around the house, for example, the toilet, bath, or bedroom. Keep an identification card with contact number on the person in case the person gets lost.
It's also important to keep Mr. Ibrahim involved in all family activities.
Of course.
The support and care you provide with your family is crucial, Zaina, and it will help a lot. Mr. Ibrahim, do you mind leaving us for a bit? I would like to speak to Zaina.
I'll wait outside.
I'll ask the nurse to accompany you. Zaina, who is the main person taking care of your father?
Me. My sister tries to help, but she lives far away in a small village and has many responsibilities and cannot afford to take care of my father. My mother passed away 5 years ago, and since that time, my father has been living with me and my husband. Thankfully, my husband is very close to my father and helps him in many ways.
That is great that your husband is able to help. Taking care of a person with dementia puts a lot of pressure on the person doing it. How are you going?
What is the impact on the carer? There are a number of potential strains on the carer. Psychological, stress and feelings of hopelessness, depression, needs management as appropriate, physical, poorer physical health, more visits to the doctor, social, friends and families embarrassed, social isolation and exclusion, financial, loss of earning from time away from work, medical bills.
Some days are a bit more difficult, but things are okay in general.
Are you still seeing your neighbors and friends?
Yes, I have coffee with my best friend each morning.
How's your energy level?
Most days I'm fine. Sometimes I feel a bit tired.
How's your mood?
Okay, I guess. I'm a bit worried for my father lately.
Are you still enjoying things that you usually like doing?
Yeah.
Are you feeling your heart beating fast?
No.
Do you feel your hands shaking or your muscles tense?
No.
Zaina, I think you're coping well. However, the situation of your father will get worse over time. It's important for you to take care of yourself so you can keep on taking care of him. Be sure to get enough sleep and that you eat well. It is also very important to do some regular physical exercise, such as walking 45 minutes 3 times a week. And it's important to have regular breaks. Is there someone that can keep an eye on him for you?
Yes, my sister sometimes comes and spends a few days here. This gives me support and help in the house and in taking care of my father.
Good. I encourage you to keep doing that as much as possible if it relaxes you.
Thank you, doctor, for everything.
You're welcome. Get your father back to see me in 3 months to check on him. By then, the neurologist will have seen him and given us his opinion. If at any point you feel like your father's situation is getting out of your hands, or if you're facing new difficulties, you can come earlier, of course. I'll also give you the phone number of an association for the families of persons with dementia. It might be helpful for you to get in touch with them. Also, here's a brochure about dementia. We will also be sure a community health worker can meet with you and teach you some general principles that you might find useful of how to take care of someone with dementia.
General caregiving principles for a person with dementia. Relax the rules. There is not a right or wrong action as long as your loved one and you are safe. Try to stay calm and patient. Use reassuring tones of voice. Avoid negative words and tone of voice. When giving choices or instructions, keep them simple and with only 1 or 2 steps to avoid confusion.